I think I had a perfect pregnancy, especially for being pregnant with twins. We still don't know exactly what happened, but the key is that Sophia lost all of her blood through placenta to her sister. When she was born, she wasn't breathing, she had no heartbeat, no blood pressure, and then she went through a lot of transfusions and she was put on a ventilator to help her breathe. After 10 days being at the hospital where we delivered her, she was transferred to Johns Hopkins NICU to be put on dialysis because at that point it was clear that her kidneys are not coming back just now.
We have to put in a catheter surgically in her abdomen, and then we have to start the process of dialysis.
She spent 4 months at the NICU. They got her liver under control, her lungs, her heart.
As we got her onto dialysis, we were able to stabilize her. Her pulmonary status improved. As we were able to dialyze her better, we were able to give her better nutrition. With better nutrition, she was able to heal better.
First, when we just got home, there was lots of issues. First, it was her reflux. We fed her through her G-tube with a feeding pump. She wouldn't take anything to her mouth.
Hi, Irina. Okay, well, how's her weight today?
I was on the phone with the Johns Hopkins doctors, sometimes 5-6 times a day. And I really appreciate that because otherwise I would feel totally lost. After 1 month at home, I tried to give her a bottle and she took it by mouth. So we just lived our normal life during the daytime, and at night I would just hook her up.
Her parents are wonderful and they learned how to provide the care she needs at home.
It's my job in our family to prepare this machine for dialysis for Sophia.
We see dialysis as a bridge to transplant. Our goal is to get her a kidney. My hope for Sophia is that about the age of 2 or about 22 pounds, we will get her a living-related or living-unrelated kidney donation. And I hope that if all goes well, that the surgery is without any complications, as it generally is, she can be home within a week. Our transplant program is great. We do a lot of clinical research looking at transplant outcomes. One of the things that Johns Hopkins offers is state-of-the-art clinical care. We are constantly improving and looking at what we do and try and make sure that we can't do it better, because if we can, we want to.
What I really like about the Johns Hopkins Children's Center is teamwork. It made me feel very confident that everything is under control, everything is going to be well. Her primary care nurses, they couldn't give her better care. They were very caring, very gentle with her. And I just felt that they love her.
When I think about what we offer at Johns Hopkins and why it's so special, I think we have a very dedicated staff, both physician, nursing, social work, nutritionists. We work together as a team.
I feel just blessed that we live close enough to Johns Hopkins Center that we were able to get in there, and Sophia is being treated at such place.
I think there's a tremendous amount of hope for these children. I think even in the last several years we have come a very long way in our ability to dialyze and transplant patients. And I think Sophia's a great example.
She's a very happy girl. She's very smiley. It's a pleasure to be around her. We love her. She's our sunshine.
So in 5 years, what I would hope is that we'll really understand how to slow the progression of kidney disease and perhaps halt it so that children don't have to have dialysis chronically or need transplant. But if they do, I'm really hoping we have a better donor source for our kids so they don't have to wait on the list.
I will remember about that guys all my life because they saved the life of my daughter.